grounds, and as pharmacists, we are here to ensure each one is protected. With the theme for this year's World Heart Day 2025 being Don't Miss a Beat. This session is dedicated to raising awareness about heart health, highlighting the role of pharmacists in cardiovascular care, and empowering pharmacy professionals and students to contribute meaningfully toward healthier communities. I am Maliha Afreen, your MC for today's session, pursuing PharmD from St. Paul's College of Pharmacy, Hyderabad, serving as Project Head and Project Subcommittee, IPSF National Executive Committee 2025. Before we move ahead, let me briefly share about our association and introduce Pharma Talk series. Next slide. Indian Pharmaceutical Association is the national body representing over 1 million pharmacists and pharmaceutical scientists from industry, academia, regulatory, hospital, and community pharmacy, and work to meet India's healthcare needs. Established in 1939 in Banaras Hindu University, IPA is a non-governmental organization with official relations with FIP and WHO, having a vast history of 80 years advancing the pharma profession nationwide. About IPA CPD. The IPA Community Pharmacy Division works to strengthen the role of pharmacists, raise professional standards, and improve public health through community pharmacy services. Its key initiatives include good pharmacy practice guidelines, antimicrobial resistant project, consumer medicine education, and public health campaigns. Through collaborations with WHO, CDSCO, government bodies, academia, and industry, IPA-CPD continues to advance pharmacist training, responsible medicine use, and community engagement across India. About IPSF. The IPSF is a network of motivated young pharmacists and pharmaceutical graduates within IPA. IPSF was formed in 2008 in Mumbai in the presence of former President of India, late Dr. APJ Abdul Kalam. The IPSF objectives are to facilitate connections and networking so that new ideas can be started and shared, and to open doors to information and new possibilities. We are widespread and are in about 15 states with 5,000 members. Pharma Talks series. Pharma Talks is an initiative by IPA-CPD in collaboration with IPA-SF aimed at spreading awareness and information about various health topics through interactive webinars. The series engages pharmacists, healthcare professionals, and students providing up-to-date knowledge on disease prevention, patient care, and public health. It encourages active participation and discussion to promote informed healthcare practices across the community. Through these webinars, IPA-CPD and IPSF aims to empower pharmacists to become better educators and advocates for public health. Before we begin with the session, we have a few housekeeping announcements. Please keep your microphones muted throughout the session to avoid disturbances. If you have any questions for our speakers, kindly type them in the chat box. We will take them up during the Q&A session. And finally, if you are not yet a member of IPA, we warmly encourage you to join us and be a part of our professional community. You can become a member through the link on the screen. Thank you. Now, it is our privilege to have Dr. Sunita Srinivas Chandrasekhar ma'am as the moderator for today's session. Next slide. Dr. Sunita is a distinguished public health professional and academic with over 25 years of experience in global health initiatives, community engaged research, and health system strengthening. She has led the Zero Dose Learning and Story Generation project within the Sabin Vaccine Institute Consortium, supported by Gavi, and collaborated with partners such as VACFA, eBase, PHC Global, and the University of Western Cape on projects addressing vaccine equity, antimicrobial resistance, and maternal and child health. She has worked with leading organizations including WHO, USAID, the Bill and Melinda Gates Foundation, the Rockefeller Foundation, and JAPIGO, contributing to projects on essential medicines, Kala Azar elimination, and COVID-19 vaccine safety surveillance. A former professor at Rhodes University, South Africa, where she was the first female academic in the Faculty of Pharmacy to be rated as a scientist by the National Research Foundation. She continues to serve as a visiting professor and remains active in collaborative research. Her contributions have earned her several honors, including South Africa's National Excellence in Teaching and Learning Award, Rhodes University's Vice Chancellor's Award for Community Engagement and Internationalization, an Oxford Fellowship at the British Heart Foundation Centre, and the Telleries Network Award for Community Engagement. Her maternal and child health research has also been recognized by UNESCO. Without further delay, I now hand over the virtual stage to our esteemed moderator, Dr. Sunita Srinivas Chandrasekhar ma'am. Ma'am, the platform is yours.
Thanks so much, Maliha. What an absolute privilege to be introduced by young leaders like you, who are the future of this country and of this profession. So thank you so much. A big, acknowledgement and thanks to the IPASF, which is rising, which are the who are the rising stars for us. So I think that's also another key aspect. Today we have gathered here, and what we are trying to achieve through this webinar is have a very balanced outlook that comes one from a primary healthcare officer, who I'll be introducing in a minute, and what is being done in the public sector in India, and on the other side, to bring in the excellent experiences of an academic, a researcher, and a public health advocate, and how that is being used to tune the way we will look at what we have to learn in the PharmD programs and how do we succeed. So what we are here for is don't miss a beat is what we are looking at. So that is a theme for this year's World Heart Day. And that theme came about to create the awareness that needs to happen, because a lot of people will go missing. And the reason for that is if we are not paying attention and understanding the signs and symptoms, and if you're not doing what needs to be done in terms of either medication adherence, as well as the lifestyle changes that need to be brought in, then the cardiovascular conditions are going to be a major barrier in whatever we need to achieve in this country. So just one context setting, in the year 2012, what happened was when the global leaders came together and realized that it is the low and middle income countries that are paying a major price in all of this, because it is in countries like India and the rest of the low and middle income countries that we are seeing a epidemic increase in all the non-communicable diseases, and cardiovascular diseases are right there standing first in line. So today we will hear what happens in the public sector from Sister Shabeena Taj. Ms. Taj holds a master's degree in sociology, and she has completed her junior health assistant training. What she has also done is, as part of the in-service program, she has been trained in terms of communicable and non-communicable diseases, skilled birth attendance, and whatever needs to be happening through the national programs in India. She brings with her 19 years of dedicated work experience, because she has served in rural areas for 14 years and in urban settings for 5 years. Currently, she's serving in the urban setting. She has been actively involved in providing women and child health services, conducting vaccination programs, implementing school health initiatives, and basically implementing the national health programs at the community level. Now, all her hard work has been recognized well, and to top it up, she has received the awards. So she has the best service provider in rural areas by the JSS group, and she has also received the best service provider by the District Health and Family Welfare Department. What we are very proud of and very happy today is we would like to now invite Ms. Shabeena, who is a dedicated and an experienced primary healthcare officer with extensive expertise in community outreach, maternal and child health services, disease prevention, health promotion, etc. So, Ms. Shabeena, the floor is yours. Over to you, and take it from here. Thank you.
Good evening, everyone. Here, my name is Shabeena Taj, PHCO, working in Urban Primary Health Center, NR Mohalla. I'm well fluent in Kannada and Urdu, but this webinar is in national initiative. So please be aware. Here as a PHCO, I am in community level. We collect yearly collect all the data of basic level data from the community by visiting door to door. As NCD is like HTN and cardiovascular diseases. So many data will be collect. Later that we will be uploaded all data in NCD portal. Such as above 30 years people's are we screened as CBAC form, which all are initiated by government portals. So in village level, in our designated area, we screening above 30 years people's for all the type of diseases. We segregate them as positive cases and negative. Later, nowadays there are 25 to 30% increases of HTN and cardiac diseases per annum as the surveillance we do and we entered in NCJ portal. Why we seeing increasing these numbers is because of the people's using food high in salt, fat, sugar, both in home and outside. And also they reduced the traditional foods habits, increasing the uses of processing foods, and also portion size increase, and also no physical activities. Reasons for this in our community level is due to obesity, high cholesterol, high BP, smoking, alcohol users, in pregnancies, preeclampsia cases. Other reasons are genetic reasons and also age-related reasons. So as a PHCO, our role in community is we are implementing the national programs, especially earlier there is only NP-NCD. Nowadays, now new national program is MP-NCD and CVD, means National Program for Prevention of Communicable and Non-Communicable Diseases and also cardiovascular diseases. So regularly we doing surveillance. In apart from that we do data entries and also track the all cases of HTN, diabetic and cardiovasculars. Also we in community level we organize the awareness campaigns. So regarding in community and Anganwadi centers for general public, in schools for students, in prisons. So in all these places we organize the awareness programs with the coordination of women and child department and also the corporation department and the education department. We give the awareness regarding disease control and health promotions. Apart from that, we also do the outreach campaigns in underprivileged peoples who are can't reach to hospital. We go and do the outreach campaigns in village community level, where we go, we check all the basics test like BP, and also after that we screen, diagnose, later put in treatment. Also we follow-up test also do. Later we door-to-door visits and give counseling to the such peoples. Responsive care provided in public sector, especially for the underprivileged peoples and also in the critical conditions peoples, and also we give palliative care services to underprivileged peoples who really need from the public sector. These are the roles of PHCO. Such in public sector we doing. Really, this is a critical job we are doing, but we are dedicatedly doing, and also we want healthy community and also healthy nation. Thank you very much.
Sister, thanks a lot for the summarized presentation, because what you have done very well is given a brief summary of everything that you're doing in the public sector and all the role that you play as a primary healthcare officer, and several of you who are doing all of this. So it is really commendable that your role brings in not just the digitalization that is happening, which is so important for the country, it is also about the disease prevention, health promotion, and most important, keeping the healthy. So before we take any questions or get into more of a discussion mode, I think now is the right time to also bring in the perspective of an educator who brings in excellent experiences from the field. So it is my privilege to introduce Dr. Anil Tumkur Mruthyunjaya. Dr. Anil is a professor and vice principal in the SDM College of Pharmaceutical Sciences in Dharwad, Karnataka. He earned his PhD from Manipal Academy of Higher Education. And after graduation, he worked in the pharmaceutical marketing and sales for around 6 years. And thereafter, he pursued his post-graduation in pharmacy practice. And this was his transition from the fieldwork into academics. He has served as a professor and principal in other institutions. He has also worked in international settings. He was a senior lecturer at the International Medical University in Kuala Lumpur, Malaysia, for 7 years. So we have the privilege of inviting Dr. Mruthyunjaya, who brings in 18 years of experience of teaching, of being a researcher, as well as being a reviewer for several of the journals that are listed. He has, as a researcher, authored 29 publications, 3 book chapters, and presented 11 papers at national and international conferences. Other than this, he has also delivered several guest lectures, and he is specializing in the areas or taking a research interest in the areas of pharmaceutical care services, pharmacoeconomic studies, self-care of chronic conditions, and the use of pictograms in healthcare. Now, we can't ask for a better set of expertise and competence to talk to us and to kind of, appraise this aspect on what is it that we should be looking at so that we don't miss a beat. Dr. Mruthyunjaya, the floor is yours. Thank you.
Thank you, Madam Sunita. Now I shall present my screen. So my today's topic is the role of pharmacist in heart diseases. So the major concentration will be on the drugs, diseases, and lifestyle, which is we are going to concentrate on today. So usually, as we have discussed previously, also Sunita Madam and our previous speaker also spoke about the cardiovascular diseases are rising remotely, even with the remote areas like urban as well as the rural areas, and it is climbing millions of lives annually. So, in this aspect, as a pharmacist, we should play a very crucial role in both prevention and management of these life threatening conditions. Hence, what is our role and what is our focus should be. So, it should be like optimizing of a drug therapy and ensuring of a medication adherence, and as well as promoting evidence-based lifestyle modifications that is dramatically improves the patient's outcomes. So how do we look at this? As a pharmacist, what we are going to do, what can be done, and what should be done? So as a pharmacist, we are. I could proudly say that we are medication experts. Specifically, if you wanted to become a specialist in the cardiovascular pharmacotherapy, you can become one, and then you have all the knowledge about the cardiovascular pharmacotherapy as well as the drug interactions and optimal dosing strategies. That is, we are expert in that concept. And then you can also become we can also become a patient educator, specifically the patients when they have been diagnosed with a new disease. It may be hypertension, or it may be angina, or it may be arrhythmia or heart failure condition. The patients were unaware of how the disease comes and what it is causing them, what is the difficulty they were causing it, and what would be the risk factors, and what is the importance of a treatment compliance to improve their clinical outcomes. That is very much essential. In this aspect, as a educator, as a patient educator, we as a pharmacist plays a very vital role. And also, we will be able to guide for the patients, specifically related to as a lifestyle modifications, specifically related to dietary modifications, exercise programs, and most importantly, behavioral changes. And also, the most another important parameter as a pharmacist in this segment is as a safety monitor. So you can keep a surveillance on adverse drug reactions, And we can also look out for the therapeutic effectiveness and adherence patterns so that the patient gets the maximum benefit out of the pharmacotherapy. And the most important, as a pharmacist in the healthcare setup, you are a care coordinator. You are in a bridge, and we are in a bridge between the physicians, patients, and other healthcare team for optimal outcomes. So usually, when I'm saying talking about outcomes, the pharmacy, FIP, and WHO says about the pharmaceutical care concept and the echo model. I just wanted to remind the students, echo model talking about the economical outcomes, clinical outcomes, and humanistic outcomes, which talks about how the patients can get the better outcomes, specifically when the patients has been intervened, how the cost would be reduced, and then the clinical outcomes, whatever the patients are suffering. It may be angina, or it may be cardiac heart failure, or it may be a hypertension cases. So how to improve their clinical outcomes as well as their quality of life. So this is one of the most important parameter. We should look into that. And when we go a little bit, we deep dive into the drug counseling. So, as a pharmacist, I should give clear instructions on the dosages, optimal timing, and proper administration technique for the maximum therapeutic benefit. Say, for example, whether it has to be taken 25 mg, or it is a 250 mg, or 500 mg, and then when to take, how to take. That is the most important. Whether to set that medication has to be taken before food or after the food, or it should be taken in the evening. For example, warfarin. So we usually ask them to take it at the 4 o'clock in the evening. So what is the ideal time for that? And what is the proper administration technique, specifically related to if it is a chewing tablet, or keeping tablet should be kept under the tongue, so that information has to be given. And then usually these medications, the cardiovascular medications, usually takes a long-term medications, and this is very difficult for a person who doesn't take any medications before, and immediately when the patient has got an angina and he has to take the certain medications for a couple of years, and it would really impact their the quality of life and their routine. So in this concept, the pharmacist should, and I should also, as a part of the team, I should able to emphasize the importance of the medication adherence, and then so that the patients can continue to take the medications. And then it should be also told about certain drug interactions can happening if that prescription has certain parameters, certain two medications like aspirin with heparin, or clopidogrel with pantoprazole, that may cause us certain interactions that would cause lot of problems, and then effectiveness will be an issue. So that is another important primary criteria. We should look into it. And then if there is a possibility that when we take these medications as a polypharmacy, we take multiple medications, and in that concept, there are a lot of common adverse effects will going to happen. And if it is so, then how to educate the patient on what to take, and if when they take a medication, what side effect may occur, and if it is so, what kind of a measurement, what kind of a remedy they have to take care, and if it is essential, if it is a life threatening conditions arises, then when to take the um, medical advice. So that is most important. So, and we can also use artificial intelligence, and then a lot of apps are coming. Our pill organizers are there, smartphone reminders are there, like a medication management, like a medisafe dose cast medications every day. So there are multiple apps are available in the market, which can be compatible with both Apple and Android phones. So that better usage of that would be helpful for the patients to take the medications without any issues. And then, as I told you, the patients doesn't know about the majorly about the diseases, so we should also target about the patient should be aware of the what is that disease they are suffering. And once they know about the disease, they could able to comply with the medications, and then they could able to get the better outcomes. And then we should also teach them the self-care skills, and then specifically related to blood pressure management, blood pressure devices, or it may be blood glucose monitoring. So these things, and then we should also tell the vaccination programs specifically related to cardiovascular for the cardiovascular protection, like annual influenza and pneumococcal vaccinations. So this is another important work we can work upon these parameters. And then I told you about lifestyle modifications is very much essential, and specifically the patients who are suffering from hypertension, cardiovascular diseases like angina, myocardial infarction, or heart failure conditions. So dietary optimization, low sodium intake, low saturated fats, increased fiber consumption, physical activity, weight management, tobacco, alcohol, stress reduction, etc. But here I would like to quote only one important parameter here, the 30-minute brisk walk. So usually the people were majorly when the patients come to you, they may be having a sedentary lifestyle. So when to them, to if you tell them directly, you have to take a 30-minute brisk walks 5 days a week, they never take up. So there is a way I could able to find that I have used it in my PhD for for my patients. I started telling them to take up a 5 minutes walk. I don't say 30 minutes. I just tell them 5 minutes walk. You have to leave from your home. 5 minutes, you have to go for a walk, brisk walk. Brisk walk is like a walking means walk like a king. So the patient should walk like a king for 5 minutes only at the beginning, and tell them go there 5 minutes. You take a relax if you wanted to sit for some time, 1 or 2 minutes or 5 minutes, and then come back. So here what I am doing is 5 minutes going and 5 minutes coming. So that is a 10 minutes walk. Okay. And then you tell and I used to tell the patients, then once they 1 or 2 days later, you increase the time duration from 5 minutes to 6 minutes. So that means what I am targeting is 12 minutes, and then continue stepwise, ladder wise, you improve up to 15 minutes. If you tell maximum 15 minutes, the people will willing to follow that. And but in the background, what you are doing is 30 minutes, because once they go 15 minutes and they take a rest and then they come back, it would be 30 minutes. Okay, so this is the what we call jugaad I did for my patients, and it helped and it has given me the very good results for this type of activity. And then say for example, I put just a one hypertensive case patient who is also diabetic, and then he is also having multiple cardiovascular so what needs to be told: medication timing, ACE inhibitors like amipril, lisinopril has to be taken every day, same timing. The patient should avoid nasal decongestant like pseudoephedrine or pseudoephedrine and just other medications, phenylephrine. So, but it because it constricts the blood vessels. So once it constricts the blood vessels, so that it may increase the BP. And then certain non-steroidal anti-inflammatory like ibuprofen and naproxen, it also causes certain blood pressure elevation. And then we should always told the patients to monitor their symptoms and their blood pressures and blood glucose level we should tell them how to use that equipment properly. And then also we should as I told you earlier, dietary modifications like a sodium control, or even if it is a heart failure patients, certain times we may restrict the fluid intake. So we should tell the patient why we are restricting the fluid intake to 1 liter. If we didn't give that particular information, then the patient will not follow that regimen, and then they may undergo a lot of complications over a period of time. So, and also we as a pharmacist, we will be going with interprofessional partnerships with other healthcare providers like a dietitians, nutritionists, physiotherapists, naturopathy, yoga, and those people. And then you can create a module for them, and then they can be able to give the better suggestions. And then as our primary healthcare officer was communicating that we have to outreach the community for screening programs, and then we should also give them if they need any further information on the diseases or lifestyle modifications or drugs, so that we can give a authentic evidence-based medication, evidence-based data. Okay. And then, so I'm just highlighting here the majority of many pharmacist intervention data articles have came in the market. It's available in the PubMed or Google. So it clearly says that if a pharmacist has put an intervention, so it really enhances the quality of life, improves the therapeutic outcomes, and it has a substantial cost savings for the patient. So that it is talking about, I told you about ECHO, that economic, clinical, and humanistic outcomes that it could be able to achieve with the pharmacist intervention. So my final conclusion for today's session is, as a pharmacist, we are nothing but a drug expert. We are a disease educator and a lifestyle counselor. So that is what we call, we can we can put up a essential role in cardiovascular disease prevention and management. So, and then together we can transform the cardiovascular care and save lives through our pharmaceutical expertise, patient education, and compassionate counseling. So this is my presentation for today. And finally, few days back, we have completed, we have celebrated the Pharmacist Day, World Pharmacist Day. So same as the same line. So whenever you think of a heart, you think of a pharmacist. This is the slogan for me, from my end, to the World Pharmacist Day. World Heart Day. Thank you. I'm open for the questions. If you have any questions, feel free to ask me.
Thanks, Doctor. This is really, it's food for thought for all of us. And while the questions come up and Maliha takes up the questions and goes ahead with it, just to kind of, bring in your perspective as well as Miss Shabina's perspective. You rightly said that, the jugaad that you did about the 5 minutes walk. I think that's such a clever way to do things, because instead of telling somebody go for a 30 minutes walk, which is so difficult to achieve, starting with 5 minutes makes a lot of sense. And also people who have knee problems, weight problems, can't move quickly, 5 minutes is more doable than 30 minutes. So that's a very good takeaway. Uh, do you have any other jugaads you can share with the team so that they come up with more questions and start asking you? And Maliha, you can take over the questions from here.
Okay, and another important parameter is you should understand the dietary lifestyle, because I worked in Manipal where the cardiac patients they are basically from coastal area. So and in coastal area you should be aware that they will be eating a lot of fish and seafood. So specifically when it is a seafood, there is a possibility that they take a dry fish. Okay, so if we say dry fish, it has a majority of the item is 90% is the salt. And in the South Canada where I worked, and they also take the ganji, that is it's a poultice kind of the thing. They will consume it, and they consume it with pickle. So when you are commentating on the lower sodium intake, you should tell them properly that you should not take the dry fish, and as well as you should not take a pickle. And many people in specifically in southern region, the pickle is their part of their diet. So when they take a pinch of pickle, that is also directly going to adding that their salt intake. So again, so these are the few things we only it can be able to get it through direct interactions with them. Once we understand what they eat, what they consume, how much they consume, then based on that, it's like it's a personalized, tailor-made interventions rather than it's a ready-made content. So we should talk to the people, and once we talk to the people, we can get a majority of the ideas. That is my observation and my following. I used to do the similar way, but since I am in academics now, I lost the touch for some time over a period.
Thanks, Doctor, for sharing that. Uh, Sister Shabeena, one other thing you could highlight on for us before the questions start is how the digitalization is progressing, because 60% of India is rural, and in the 40% of India that is urban, you are serving the underprivileged groups. So please, can you expand a little bit more on the digitalization?
Sure, ma'am. Actually, madam, we are yearly we are doing the service. Sorry, calling
Sorry,
as special
sister, we
Jira
can't
surveillance.
hear you well.
Hello.
Yeah, now it's better. Please go ahead.
Hello. Yearly once we do the surveillance, like CPAC surveillance. In that surveillance, we visit every door-to-door visit, and we take data from the every house, ma'am. In this surveillance, we also take HDN and cardiovascular related illness. Also, we upload all the data in the NCD portal, madam. In NCD portal, there is about 30 years age group people. We screen all the everyone we screen hypertension, diabetes, and also cancer, everything person we screen and put in that portal. Later that screening portion completed after who all have the HIV and diabetes. We every treatment diagnosis. Later that we follow them. Through the through HCP portal also we track them. It's later we door-to-door visit and also there also we track them. So we tell them their condition, treatments, everything. So whatever it is, if it's any risk, we connect that person to the medical officer of the health centers. Later, extra treatment or anything else they need, we provide them.
Thanks, Sister. Maliha, are you ready to take over?
Yes, ma'am. Thank you, ma'am. Thank you so much, Ms. Shabina Taj, ma'am, and Dr. Anil, sir, for sharing such valuable insights on the role of primary healthcare officers and the role of pharmacists in managing heart diseases. On this World Heart Day, we have all gained important knowledge on preventive care and self-care skills to maintain a healthy heart. And we will now move into the interactive Q&A segment. I encourage all the participants to share their questions in the chat box. And we have a few questions here. Sir, I'll read it out, sir. How can pharmacists contribute to cost reduction in cardiac care without compromising treatment quality?
Yeah, this is the same. I anticipated this question, and that's the reason I prepared this question. I prepared this topic. Counseling. Okay, when the patient comes to you and with the problem of cardiovascular problem, it may be hypertension to heart failure. You should counsel. First, you should understand the case sheet, and once you understand the case sheet and the medications they have been prescribed, you do the check do check out for drug related problems, and if you found that any drug related problems, address them on a priority basis. The most importantly, the disease management, you have to tell them, and that can be done through a visual aid. So you can prepare a visual aid specifically for that particular disease. Say for example, I used to do my PhD work is on angioplasty patient. So I used to tell what is the blockages, where it happens, what is the coronary artery, how the blockages are happening, how the angioplasty has been done, how the stents has been installed, and then based on that, later what would be the medications they were giving, why they were giving these medications, so that they will be aware of that. If you take the medications, there will be no further clots in the same area, and then that there will be they need not to get readmitted into the hospital again, and then they will come back, and then they have to undergo certain laboratory tests when they come for again for the retesting or a regular checkup. So they need to go for the glycolated hemoglobin, or hypertension, or even it is a thyroid, what we call a lipid profile, a renal profile. When we give that, so when they come back with the results, we will compare with the first and the second one, pre and post, and then we can able to tell, because of this your risks has been reduced, so that the patient will be aware that yes, because of the medications I take, my risk has been reduced, and so that I can lead a quality of life for further this further life. So I also used to tell to the patients that you have got a diabetes, so don't think that diabetes or hypertension you got, it's a boon, okay, in disguise. So I used to tell them, you have now you got it, the disease, don't worry. So what you need to do is it will help you to be in a systematic manner. You can come back to the what we call a systematic manner. You will be eating whatever you're eating, you will be monitored. Whatever your your lifestyle, that will be monitored, and whatever the medications you are taking, that will be monitored, so that overall your quality of life will improve, as well as lifespan also will improve, because of that you got a disease. So once you tell whatever it is negative is there, that you convert it into positive, that helps them a lot. And this is what's good. And then once it is done, then you talk about their the story, and then make them, convince them that usage of the lifestyle, that what I told you, the visual light, and then that helps them to remember them what needs to be done, because you know that the learners are different. So each person is different. Some people will remember what you said, some people will remember what you show, some people may need videograms, videos, or YouTube videos. You show them whatever according to their need, and then, or you can prepare on these items and then show it to them, so that will be remain in them. And then you can also send those. You can take a printouts of the patient information leaflets, give it to them, or you can send your YouTube links to them, so that they can learn, they can remember, they do better. So this is the modus operandi, or this is the modus operandi of helping them out in critical situations.
Thank you, sir. That was a very elaborate answer and it was very informative. There's one interesting question in the chat box, sir. What are this one? What are the challenges healthcare professionals, especially pharmacists, face when ensuring patient adherence to treatment plans?
Yes, I have a lot of examples, because until unless they know, that's the major problem. Until unless you tell them what is the disease, why for this disease, why this medications has been given, if these diseases, how it is correlated to each other, and if they know this, then they will be able to help you. They will take the medications better. Instead of that, you just tell, you take aspirin and clopidogrel one morning and once in the night, and then you take a statin, and then they started multiple things, and then finally 1 day, 2 day, 5 days they will take, and then after a 20 days they will slowly dropping out of one morning in the session, and then once time, or they will forget about, they try to avoid the evening sessions. So they will try to avoid the medications over a period of time. This is a major problem with long term medications. Until unless you convince them, and you create in such a way that it is essential for them to recover from that practical problem, that the clinical problem, medical problem, and then only they should ensure that when they take these medications, they will be free, they will be happy, their quality of life is improved, they can go elsewhere, they need not to restrict themselves. Okay, so if you tell them in such a way, that then they will listen and they will follow. Until that, it's very difficult. And today's scenario with the doctors, I don't have the time, just they will give you, take these medications, come back after 3 months with this type of a laboratory test. uh, Maybe they may take for 15 days or 1 month, but surely definitely they will not be able to do it for 3 months. The chances I had seen multiple times. Until unless you keep on giving in a counsel over a period of time, it's very difficult to maintain their medication adherence. Again, it is them, the patients should take. You can give something, your effort would be there, but the ultimate uh, the person who takes is the patient. And until unless he or she takes it, nothing will work out. So make sure them they take this medication. by realizing the value of the medications.
Yes, sir. That was a very nice answer, sir. Hope this was a good understanding. Next question. It's for both the speakers, ma'am and sir. In what ways can healthcare providers incorporate mental health care into heart disease prevention strategies, given the link between stress and cardiovascular health?
Can I answer or madam will answer?
Yes.
Answer, sir. You want to answer, sir.
Okay, okay, madam. Actually, the reason is very simple, madam. Actually, I shown in my slides also saying that lifestyle modification, stress plays in a very vital. I had seen the patients even starting from the age of 35 with their habits like smoking and drinking, and from that to the stress. Okay, even I had seen the 40 years old bank manager is getting an AMI and they get admitted to the hospital. So that's a very unfortunate thing. And then mental stress is plays a very role. In Kannada, we say chinte. Mental stress is we call it as a chinte, and chite is a the dead body. So there is no difference, but except a zero in between chite and chinte. So it means that if you start thinking too much, you are going to die. The best example I can give you is that for them is to go for the yoga, meditation, and even if they don't want to do the meditation, they were unable to do it. Simply breathing exercises, simple pranayama would help them in a larger way. And it happened to me, and it helped me a lot. And then for my whoever I prescribed this breathing exercises, it helps them a lot. For 1 or 2 days it may not be able to give you the information at the relaxation, and the benefits may not be seen as a quick as a jiffy, it will not come. But if you keep doing it, absolutely it helps over a period of time. And if they are very if they have anybody in their vicinity or a locality, let them go to a yoga instructor, get them trained in that, let them go for a 3 months online courses or a 6 months online courses, or if it is possible they can go face to face, that would be more ideal. Let them learn the stretching exercises and then breathing exercises, so that gives them a lot of benefit over a period of time. So stress, again, it's a major conspirator, major risk factor for CVD. Yes, it has to be told during your counseling session. You can use YouTube videos, you can prepare on your own, or you can use somebody's YouTube videos and show them, so that it helps a lot. Yoga, and we in our university we are having a research unit. They were talking about the yogic influence. Yoga practice of yoga helps them in the hypertension. So we had the one large trial, multi-center clinical trial is going on with our university, and we are getting a very good results with the yoga practice with their outcomes, clinical outcomes, and as well as humanistic outcomes. Humanistic outcomes, I'm talking about the quality of life.
Yes, sir. I do agree with that. Breathing exercises, yoga exercises are really helpful to de-stress and for yes. And sir and ma'am, we have one last question in the chat box. In their cardiac treatment.
Ma'am, repeat, ma'am.
Pharmacist addressed medication-related stigma and ensure that patients experiencing the side effects remain adherent and confident in their cardiac treatment.
In our public sector, there is so many stigma. If once we started treatment for HAM or anything, it's a lifetime treatment. We will be addicted to that. It is a time for treatment. So later, first initially they can't start treatment. They were their own exercises. They and also they do some whatever they are doing. Later, when it's most dangerous time, they will come and they started with the stigma. Yeah, what they think is once they started, they will be addicted to drug. This is the most common stigma present in community. Later, they properly they can't come and take treatment. They don't have the knowledge. They don't have knowledge. As a healthcare is that we visit everyone to their doorsteps and also we educate them what is the role of medicine in doing treating living in a treating education cardiac treatments and trying and also problems needed them. Then also they can't understand because they are poor people. They don't want to come to hospital and don't want to waste their one day labor. Because of that, our body is
Excuse me, ma'am. Your voice is a little. It's a little unstable, ma'am. Your audio.
no, hello.
Yes, ma'am.
No, in community level,
Sister, I have a suggestion. Sister, I have a suggestion. Please switch off your video so that the bandwidth is saved for the audio.
okay, ma'am.
See, now it's completely better. Please go ahead. Thank you.
Once they started treatment, they will be addicted. Later, they will not come to follow up. When now a new program Gruha Arogya started in our state, ma'am. In this Gruha Arogya, including not only taking data, also we provide doorstep screening, ma'am. In there, how many members are there? Each and every person we screen there, and also provide treatment to doorstep. This is the new program launched by Karnataka government, Gruha Arogya. Later that we conduct yoga sessions weekly once in primary health care centers. We call all NCD patients who are all have the problems to manage their stress also to maintain their health. So these are all the programs which are implementing in community level to provide better health and also better tracking. Thank you, ma'am.
Thank you, ma'am. That was a really nice, insightful answer. That was the last question, and also Dr. Anil sir also replied to that same question. And thank you, sir. Now I would like to invite the president of IPSF National Executive Committee 2025, Ms. Komali, for delivering the note of thanks.
Hello, good evening, everyone. First of all, I would like to thank both IPA, IPSCPD, and IPASF for taking this initiative of the Pharma Talks webinar series. And this is our first series on the occasion of World Heart Day. And I would like to extend my heartfelt thanks to Dr. Sunita ma'am for moderating our session in such a smooth manner, and also our speakers, esteemed speakers, Ms. Shabeena ma'am and Dr. Anil sir, for sharing your insights and experiences with regards to community health and sharing your jugads for a better heart health. And I would also like to thank Dr. Raj Vaidya sir for taking this vision and encouragement to make this Pharma Talks webinar happen. And also, I'd like to thank Rup Narayan sir, who's the president of IPA, for gracing this occasion, and Manjari ma'am for gracing the occasion via YouTube. Thank you so much, ma'am and sir. And I would like to thank our masters of ceremony, Miss Maliha Afreen, for being the master of ceremony and anchoring it very smoothly. And thank you so much for all the participants who have joined on Zoom platform and even on the YouTube. Thank you for all your questions as well. And I hope the webinar has served the purpose of enhancing the knowledge on how you can keep yourself healthy, and how healthcare professionals and pharmacists play an efficient role in keeping in safeguarding the heart. Thank you so much, everyone.
Thank you for the opportunity to meet all of you guys.
Thank you, sir. Thank you.
Thank you.
Thank you, sir. Thank you,
Thank
ma'am.
you very much for this
Thank,
informative program. I enjoyed.
thank you, sir.
Best wishes to all.
Thank you, sir.